We're going to go ahead and get started today. Thank you all so much for joining us. Welcome to forum number 3 of Critical Conversations, a Cancer Learning Series. This forum is brought to you by the Oncology Foundation of Maryland and the District of Columbia, which we love to call OFMDC. Our mission at OFMDC is to bring together in a non-competing forum patients, patient advocates, doctors, and the research industry to provide education and information on available cancer resources at no cost. Today, we're going to focus on proton therapy. We want you to walk away with an increased awareness about this very unique treatment. And our guest expert today is Dr. Kunaprayoon of the Maryland Proton Treatment Center. I want to tell you a little bit about Dr. Kunaprayoon. He focuses on the management of patients with gastrointestinal tumors, thoracic, head and neck tumors, as well as patients with lymphoma, leukemia, myeloma, and sarcoma. He is a graduate of the University of Maryland School of Medicine, where he completed his internship. He also completed his internship at Cornell and his residency training in radiation oncology at the University of Cincinnati, where he also served as chief resident. Following that, he completed a fellowship in proton therapy and advanced radiation modalities at the University of Maryland. One good thing to know about Dr. Kunaprayoon is that when he is not working and doing all these great, wonderful things at the Maryland Proton Treatment Center, he enjoys hiking. He last traveled to the beautiful Yosemite National Park in California, where he did some hiking there. Welcome, Dr. Kunaprayoon.
Thank you, Joanna, for that brilliant introduction.
You're welcome. Thank you for being here. And thank you for taking the time out of your busy schedule to join us.
Thanks for having me.
Let's start with the very basics of proton therapy. What is proton therapy? And then we'll talk a little bit more about the Maryland Proton Treatment Center.
Yeah, so proton therapy, kind of the basics of it is it's another form of radiation. The conventional radiation is what we call photon therapy or regular radiation. You may hear it referred to. But protons are different than that. They are heavy particles. They have mass compared to photons, and that gives them the physical property that they stop at a depth in the body and don't go out the other side from where they enter. And we'll talk about it more later, but the potential benefits are being able to spare normal radiation to the normal organs primarily.
Awesome. Thank you for sharing that. So we have this great treatment, and we're going to get more into the benefits of it and who's a great candidate for it. But I'd like to highlight some of the great things about the Maryland Proton Treatment Center that we have located here in Baltimore, Maryland. It is the only center in Maryland that provides proton therapy. And what else? What are some of the other things that's very unique about the Maryland Proton Treatment Center?
No, like you said, yeah, it's the only proton center in Maryland. It's only one of the few. There's still not that many in the country yet. There are more and more, but there's still very few proton centers overall in the country. We are one of the first ones on the East Coast. We're one of the largest ones on the East Coast. A lot of folks who have come and gone to other proton centers have come through our center at some point. And it was a big kind of infrastructure cost around around 2015, 2016, that time frame. And so I think it's one of the kind of latest and greatest technologies that the field of radiation oncology has to offer.
That's so awesome. I read that there are 41 proton centers in the United States currently, and another 3 that's under construction right now. So I'm so happy that we have this great treatment here in Maryland.
Yeah, so we're very lucky to have that in the region. I tell patients if they were in a different center, different city, that's something that it wouldn't even be on the table for them.
Wow, that's huge. Let's talk a little bit about the benefits. You touched on the limited exposure and kind of like the protection from radiation, but explain the main difference between regular treatment and proton therapy.
Yeah, I think the main difference is just that, like I was saying, that the protons stop at a definite tissue, and what that means practically is that we can treat tumors that, especially tumors that are in tough locations, hard to get to areas, areas that might be in really high real estate type of areas like skull base and other areas, where there might be very sensitive structures very close and nearby. We have the ability to treat those with protons. And that's something that with regular radiation, even though the techniques have gotten better, and there's been several advancements with regular radiation as well, it's still just something that you're often limited by the properties of the photon radiation compared to proton radiation. So that can result in not only decreased radiation to the normal structures that can result in improved quality of life, improved outcomes for patients. And that's all we're always trying to do, is trying to figure out the best way to treat the patients.
It's awesome. Thank you. Thank you for sharing that. So let's kind of walk through the journey of what happens in a practical way. So let's just say I'm diagnosed with a cancer tumor. How do I know if I am a candidate for proton therapy? Is it right for me or is it right for my loved ones?
Yeah, that's a great question. Not so. And certainly, you still have all the correct consultations with all of your doctors and treating team. But yeah, and not everyone is a candidate for proton therapy. But in a lot of situations, we're kind of learning more and more about how different opportunities for proton therapy. So the pardon, I just lost my train of thought. But the one of the ways is just to have a conversation and dialogue with your doctor about if protons is right for you, and that's something that the University of Maryland Proton Treatment Center, we're always happy to speak with your physician, or we talk to doctors from all across the country all the time about different situations and if proton makes the most sense for a candidate. Sometimes there is not a large difference, and then in other cases, the proton would be the only way we could treat a patient.
Mhm. I like that, because I love the fact that there is somewhat of a team approach amongst physicians with things like this. How do physicians and oncologists determine if it's right for their patients? Like, how does that happen? Do they reach out to people like you and you all discuss the patient in a very individualized way?
Yeah, absolutely. So we're always available to any physician to review a case. We often present the cases within our own tumor boards, as well as our departmental conferences to review every case. And there are some indications where I think there are somewhat obvious indications. Some of these might be, patients that have already had radiation or radiation courses with regular radiation, and you're talking about doing a second round of radiation. But then there are some, non-obvious edge cases too that, will require review and going through with the patient and the treating physician.
That's awesome. So, I spoke to a couple of people who have, had certain diagnoses here in Maryland, and they were presented with the option for proton therapy. One person that I do know received extremely high, she gave you all just extremely high rates in, the care that she received. When people are diagnosed, what happens is that sometimes, or they may not have the language or the verbiage to articulate what they need, or they don't know how to ask for treatment options. What do they say to advocate for themselves? Some people have the language and some people don't, but how can they advocate for themselves or their loved ones to see if proton therapy is an option for them?
Yeah, I think that's a great question. I mean, we have patients and we hear from them all the time. I mean, the easiest and most direct way, I mean, we have had plenty of patients that just ask, hey, am I a candidate for proton therapy? And that can often get the discussion started. We've had other patients that ask, hey, are there other ways of radiation that can do less damage to, my normal body? That can often prompt the conversation. But we've heard it from multiple people sometimes. Oh, my physician wasn't even thinking about proton, but then when we talked more and more about it, that seemed like maybe it was the right choice for me. So I think all of those are good ways to initiate dialogue and discussion with the doctor.
That's awesome. With there being only 41 centers here in the United States, and then soon to be 44, do people travel from across the country to get to the Maryland Center and even other centers, or from other parts of the world?
Yes, they often do, and I think that just speaks to some of the expertise that we have here at the Maryland Proton Center. We have patients from all over the country. I forget and Barbara may have the stat sheet, but I think we've had patients from basically every state and other countries as well. And it's it isn't for people coming out of town. It can be an investment in time and relocation temporarily, but I think people do it because they know that it's worth it. So it's something that for the right case, it can make a big difference.
And I do want to remind you all that in those cases of patients coming from far away, like from Shore or from Western Maryland or from anywhere else, we do have a really robust concierge program that allows patients to speak with somebody at the center. They can guide them to the free housing that is offered to them through the Hope Lodge, or depending on their age, some other free lodging, or if they are bringing their family, some discounted relationships we have with hotels in the area. So we try and make it as friendly and as easy access as possible. That includes that free valet parking for every patient every day, all the time.
That's absolutely right. Thank you, Barbara, for detailing that. The Hope Lodge is a boon for patients who are from out of town, and we have patients that have very good experiences from there.
Yeah, absolutely. Barbara, thank you so much for sharing that. It would be great to maybe, kind of recap the journey of what happens once a patient and once your doctor and your oncologist and the whole team decides that this is right for me. What happens next? It's right for me. You're a good candidate for it. Where is that starting point then, Dr. Kunaprayoon? What then happens?
Yeah, then we can get patients in to see us pretty promptly. The next step after consultation is we try to make sure we have all the records and any outside images beforehand, and then we meet with the patient. We discuss the treatment plan with the treating team. The next step is often an insurance approval, and we have an excellent insurance coordinator who is able to navigate that with the patient. And then from there is often what we call a CT simulation or a mapping study, any additional workup that we would need. And there we work on getting the radiation treatment plan ready and getting the patient started for treatment.
That's awesome. You touched on something that is really crucial during this process. Once folks are diagnosed with cancer or anything that they're going through health-wise, there's always that extra layer of concern for payment in health insurance, right? How do I deal with this? How do I navigate this whole space? How do I talk to the health insurance company about my needs? But I love that you all have someone who can help them with that. You know, I know that the treatment is covered by health insurance. Is that correct?
Yes, often increasingly more and more now, because insurers are realizing the benefits of protons, it is approved. In cases where it is not, there's often an appeal process that we have a lot of experience, and we do a lot of advocating for our patients with their insurance company to highlight the benefits of protons, and we have very experienced and expert personnel, like our insurance coordinator, to navigate that with them. And more often than not, that is something that we can get approved. If Proton is the right tool for the job.
Awesome. Thanks, Barbara, for putting that link in the chat to the website. You know, one of the things that Barbara sent over, which I thought was really good, is that you all have a 94% insurance approval rate for proton therapy. That's really great to hear, and I'm sure that helps patients and families a lot. Basically, it says that due to your payment model, you all kind of work with the state to make sure that you charge the same for proton therapy as you would for any standard radiation. So I'm sure that that's a huge benefit for patients, unless they have to worry about while they're working on their treatment.
That's exactly right. I think that is probably one of the biggest reasons for our approval, is that we have a cost neutral arrangement where we charge the same whether it's protons or regular radiation. So we remove that that variable is not really relevant for the treatment. It's really what's the best treatment for the patient. So that's a very unique thing that most proton centers don't have, I think.
Mhm. Absolutely. One of the things that we hear often just from me and my own layman's terms in talking to people about healthcare is that sometimes there seems to be a disconnect in certain areas. But one of the great questions we have in the chat from Kathy Thompson is, how do you get the word out to oncologists across the country about the benefits of proton therapy? Because that helps kind of even the playing field so that everyone's getting the same information. And then she also says, and the benefits of proton therapy and the locations they can choose for potential treatment for their patients. So how do you all talk? Is there, meetings that happen, discussions, forums that you all participate in?
Yeah, that's a great question. We do all of the above. We do a lot of outreach and education, of course. We meet with local and national oncologists, and we go to different group meetings, and there is we do all of that, but there is still probably a struggle and a disparity, especially for patients who may not live within striking distance of a proton center, or are kind of isolated from a proton center. So that's something we continue to work on, but we participate in the forums, we participate in the national cooperative groups, we participate in outreach and education with patients and other oncologists as well.
That's awesome. And is there an additional layer of specialized training that you all have to have related to proton therapy?
Yes. So this is maybe changing slightly, but yes, there are different advanced fellowships in proton training. There are, proton is not the exact same as regular or conventional radiation. So there are a lot of nuance and technique differences that a center like us that has some of the most experience on the East Coast, we're happy to participate in the advancement of the field and do a lot of education and research at the center as well.
Yeah, Thank you. Thank you for sharing that. Before we go into Q&A, Dr. Kunaprayoon, are there other things that you would like to share about proton therapy and you think that folks on here know? We have people who are in different, touch the oncology field in different ways. We have a couple of past cancer survivors and things of that nature. What are some of the other things that you think they should know?
I mean, we'll certainly get into it more with any Q&A that we have, but I mean, I think I'm just trying to think of things that people might not know about proton that might be useful for them. I think that, you know, sometimes we're still, as a field, as a field of oncology, we're still kind of learning about all the potential benefits of protons. Some of that is more established, some of that we're still learning. But you know, even in our experience with patients, you know, sometimes it doesn't. Sometimes you can still get a very good treatment with, you know, regular radiation or proton. But sometimes the difference can be, you know, where the cancer, you know, the cancer is still going to be very well treated. But sometimes the difference is the side effect profile of the two treatments, where one, you might have more severe side effects and might lead to more time off work and just more fatigue and other things. Whereas something with proton, there's the ability to have potentially less side effects of that. So I think that's something that for patients and doctors to keep in mind.
Absolutely. Thank you. You know, as we have the audience think of questions, one of the things I thought about is how do people choose which location to go to? I live here in the state of Maryland, so I would naturally go to the Maryland Treatment Center. But what if you're in another part of the country? Do they have the ability to choose, or are they told they have to go to the ones that's closer to them geographically?
Yeah, I think so first of all, you always have the ability to choose. You're, as the patient, you know, you have your own autonomy on, you know, who you would like to have treat you, where you want to be treated. I think practically it often comes down to, okay, well, what's closer nearby to me? How far is it from me? You know, I think we have, as you know, you're probably more likely to go to some place even an hour away rather than, you know, 10 hours away or something like that. But you know, often you're also going to look at the expertise and what's available there. How long has the center been open? You know, how many patients have they treated, and other things that are going to be very important. Because, you know, even some of the newer centers that, I mean, they may have not had the same kind of level of experience that other more experienced centers have had now. So I think all of those factors can go into how a patient decides.
So thank you. Thank you so much. That's really good. We would love to hear from folks in the audience to see what questions you have. We have a question coming in from Jacqueline. Thank you, Jackie. Are there any patients or tumor types that would not be a
Sorry, you broke up there a little bit, Yolanda, but thank you, Jackie. Jackie, our great nurse from here locally, in the nurse referral navigator from locally in the area. Yeah, so that's a great question, Jackie. There are, you know, the ones that come to mind are, so we still do a lot of small target intracranial radiosurgery and even lung radiosurgery. We still do a lot of those with conventional radiosurgical techniques. I'm talking about either things that are done in one single fraction or 3 fractions, and part of that has to do with, you know, part of that has to do, we have a long history of good treatments with radiosurgery with conventional radiation, and part of that has to do with the exact target, where it is in relation to the rest of the body. for example, targets, small, very, very small targets in the lung, proton can have some difficulty with, because protons have mass. They have to travel through the lung, which is basically just a balloon of air, and they can sometimes have difficulty stopping in the tissue within the lung. But I'm talking about very kind of specific cases, which are probably the minority of cases. But when we see cases like that, we're always thinking about what is the best tool for the job. And in some of those cases, we know proton may be a secondary tool, or we look for other types of cases that we would think about proton.
Thank you. We have any other questions, any thoughts? And I think we could have folks take themselves off mute, and you can verbally ask the question if you like.
This is Pam. I realize that I'm sending some questions in chat, but for some reason they're going only to Lisa. You answered the one question I had regarding types of cancers or tumors that might not be good candidates. The one question I had was, if you were a patient who had previously had, say, proton therapy or conventional radiation, could you be a candidate for proton therapy if a cancer returned the same type?
Yeah, Pam, that's a great question. And I would say that's one of the most common situations that we see at the Proton Center is when a patient has had prior radiation. It can be, breast cancer, GI cancer, rectal cancer, prostate cancer. Those tumors, because of what the body kind of remembers how much radiation it got. It can be, 3 years ago or 5 years ago, or even, 10, 15, 20 years ago. The body remembers how much radiation it has received. And in those cases, what we're trying to do is still give a good dose to the tumor while trying to minimize as much radiation as we can to the normal structures. And that's a very common scenario for proton therapy. It depends what part of the body we're looking at and what disease site, but those are areas where we see a lot of those types of patients, and we think that there are potential advantages for proton. And sometimes realistically, you look at it, sometimes you can even try to treat those cases with regular radiation. And we've had situations before where the outside physician says, yeah, we tried it and the plan did not look very good. And they said, well, what can you guys do, or what can we offer? And so we've seen it firsthand when we do plans for patients and we're not sure. Sometimes we will run both plans actually, and try to figure out which one is the better plan. And it oftentimes will come out the proton plan. Sometimes insurance will be will be curious to say, hey, what is proton really better than the regular radiation plan? And we look at it both ways, and we have to offer our guidance and input there. But yeah, I would say patients who have had prior radiation is a very common indication for consideration of proton therapy.
That's great news. And then there's another question would be, is there a difference in the number of treatments or the time of treatment for proton versus photon or standard? I'm sure it depends on, but is it fewer treatments? That's
a good question. It depends a little bit on the situation. In some situations, the number of treatments would be the exact same, but the dose to the normal organs at risk or the normal structures nearby might be significantly less with the proton. In other situations, and these are some of the cases we're learning more about, are because you can limit the amount that the normal tissue gets, that can actually allow protons to use higher doses of radiation to the tumor tissue, which those are cases. I'm thinking of cases like chordomas, which are rare spinal tumors or bone tumors, and those cases are cases basically where it would not be possible to take the tumor to such a high dose with the regular radiation, but because of the surrounding nearby normal structures. But because with protons we can limit the amount that the regular the normal structures get, we can actually use that to our advantage to take the tumor to a higher dose. And then there are other cases where I'm thinking about re-irradiation cases where, because the patient has had prior radiation, and sometimes we want to use sometimes we do what we call twice a day fractionation or twice a day treatments, which are basically another strategy of trying to get dose to the tumor without harming the normal tissue as much. So there are situations where it would be the same number of treatments, and then there are other situations where we can take advantage of the radiobiology of protons and use different treatment schemes.
Thank you.
Yeah, I think you touched on this a bit, but can you talk about the side effects from proton therapy, like the specific side effects that you've seen?
Yeah, I mean, so proton therapy still, is still radiation. It's still there are still side effects. So any of the side effects you have with the normal conventional radiation. So if you take breast cancer, for example, you can have skin reaction, redness of the skin. You're still going to have all of that with proton. So some side effects are, we don't expect that there's, you're not going to have any side effects. But then if you take a case like a cancer in the head and neck region, or the oral cavity or oropharynx area, I mean, those patients can have significantly less loss of dry mouth, taste, need for a feeding tube, things like that, where they can have significantly improved quality of life and less toxicity from the treatment compared to regular radiation.
Awesome. And we'd love to have more questions in chat. We do have some time left. For young people, of course, we hate to think of it, tumors as it relates to our young people, but how safe is this? Do you see young people coming through your center? Does it work for young people who have these types of tumors?
Yeah, that's a great point. Absolutely. I mean, with younger patients and, I'm thinking about young adults, even our pediatric population, one of the big goals of, when doing radiation is balancing the harm to the normal organs and reducing the chance of recurrence of control of the main tumor. And honestly, the younger the patient is, the more that we're concerned about it. Especially someone who's maybe still developing, or a child, that's of even more utmost concern. And even in young adults, we worry about the risk of secondary cancers, from the radiation, which can happen. They can happen with regular radiation as well as proton radiation. But decreasing the amount of radiation that the normal tissue gets can help decrease the risk of those toxicities and cancers later on down the road. So it's absolutely a consideration. We've treated patients with like lymphoma, where we have to treat the middle of the chest, and we've seen great advances in the decrease to the amount of dose to the heart and the lung. And you're talking about patients who, they're going to live a long time. We have very good high cure rates with regular radiation or proton radiation. But in those cases, they're going to live a long time. And, one thing you were trying to do is decrease the risk of, cardiovascular disease, lung disease later on in life. And I think that's where proton therapy can add a lot of benefit.
Thank you. Thank you. Any questions from the audience? Thoughts?
I have another question. So you touched on this earlier, but just advice to patients, and I can just go to my own personal experience where I had people telling me, "Oh my gosh, you have to get proton therapy. It's the best." Those are basically consumers. And then there's some prejudice among some care providers, if you will, saying, oh, people are going to sell you on proton therapy, but it's not proven yet, or it's hyped up. What advice could you give a patient that to do their own due diligence, especially I can imagine if you're outside of the area and may have a physician or oncologist that isn't as familiar, to really make their case and advocate for themselves if they've started to do homework and believe that proton therapy could be their best option?
That's a great question. I mean, we really stress, so when a patient comes sees us at the Proton Center, first of all, we do both regular radiation and proton radiation. So we're actually, when you see us at the Proton Center, we're actually thinking about all the potential tools we have at our disposal to come up with the best treatment solution. If you're seeing someone who doesn't have any experience with protons or doesn't, hasn't sent a lot of people for protons, you are getting, only maybe one view of things that may not be representative of what someone who has proton experience might say. I think that is a difficult area to navigate for the layperson, but I do think it is relying on, trusting some of your advocates for you, talking to your doctors, having honest and open discussions about it. And like I said, we're always happy to either schedule consultation or reach out to the referring physician or speak to them to see if we speak with outside doctors all the time about who could be a good candidate, who might not be. But I think that's, those are the steps I would take to go through that. But realizing that that can be a challenge for patients and physicians as well.
Thank you. I thought of something, Dr. Kunaprayoon, for loved ones and people who want to support their family members or, friends who may be going through proton therapy. At your center, do you all have like a separate support for patient support systems, or to teach them how to maybe help them at home, maybe how to help with their nutrition and things like that? What does that look like at the Maryland Proton Therapy Center?
So your question was just about what are some of the ancillary services that we have in terms of nutrition and getting support?
Yes, and for loved ones, how do you help loved ones help the patients?
Yeah, so we have a very extensive team here. And first of all, loved ones they're probably the backbone of any cancer treatment, as anyone who's gone through this knows or has had loved ones know. And we fully appreciate and welcome all of their help and involvement. I think they're as vital as part of the team as anyone else is. And that said, we also have our team of folks here, including people from physical therapy, people from nutrition, people from speech and swallow. We have all kinds of ancillary services that will help get a patient ready and follow a patient throughout their treatment. So it really does take a full team, which we have full complements with. But we work with outside teams as well. I think with for the patient's family, I mean, it's always helpful to have them in the room with the patient. When we see them for their initial consultation. It's always nice to see a loved one, coming to appointments with the patient. It's always good to have another set of ears, going through things, reminding the patient to, either, drink at home or keep up with their nutrition at home. So that's something we heavily involve, family and support. Even folks who can't be there during the initial consultation, will often have them on the phone while we're going over the case with them. So I think those are lots of ways that we kind of get the the loved ones and family involved.
Awesome. I love that they're seen as a part of the team. That I'm sure that's really important and valuable to the patient. Anyone else? Thoughts, questions?
I just have a thought and a question. I was wondering with the benefits to children and adolescents, or do you know if the children's cancer treatment centers or have the proton therapy available at their centers, or are you letting them know about your services so that they can take advantage of those for their children?
So I think the question is, are the children's cancer centers aware of our services, basically?
Yeah.
Yes.
Yeah, I think we have a very good relationship with Children's National and Children's Hospital and the surrounding children's centers, where I think most of those physicians working at those pediatric centers are aware of our services. So I think that is something that we do a pretty good job with. I think the patients themselves, that might be a little bit more difficult, just having that kind of direct client connection with them. But I do think that the surrounding children's hospitals have a pretty good understanding of what we offer. We work with them a fair bit, so and we have good relationships with them. So I think pediatric oncologists are, they are very motivated to, do something that is in the best interest of their patients. So I think that's they have a good understanding of what protons can offer.
Thank you. Yeah. We do have space for one final question or thought.
If no one's going to jump in, and I don't want to cut off anyone, but this is just more of a curiosity question. I believe it's my understanding that the understanding of proton therapy and the applications is growing. Do you see on the horizon, maybe through research that's happening, in terms of future opportunities for proton therapy that might not have seemed possible in the past?
Yeah, so there are a couple. That's a great question. There are a couple things on the horizon. One thing is, so our center, in addition to proton therapy, has something called thermal therapy or hyperthermia as well, which is a treatment that uses moderate levels of heat to enhance or amplify radiation. That's something that's not, pretty scarce even at proton centers. There's a few in Europe that have that. So that's something that we offer here that's very unique about our center here. We're starting to do proton therapy. We're studying the effects of proton therapy with immunotherapy and other targeted agents. That's something that's everyone's pretty excited about, and there's potentially looking for synergies between the two. There's something called flash radiotherapy, which is not really ready for clinical use. Well, it's about to be, but it employs very high dose rate radiation, meaning lots of radiation per second, and that's something that we're continuing to study in animal models and then soon to be human models. So there's always lots of things coming down the pipeline here at the Maryland Proton Center. So that's a great question.
Well, thank you so much for sharing that.
Thank you. Thank you, Pam. Thank you all for being here today. Dr. Kunaprayoon, thank you so much. I know your schedule is really tight today, but I know that this will benefit so many people. We are recording it. We're going to send this out to more folks as well. And I want to thank our sponsor, Medesco, for helping us get this education out. Again, please follow the Oncology Foundation of Maryland and DC on our website. Pay attention to the emails. We will be bringing you more forums like this throughout 2023. But we also want to hear from you about what are some of the topics you want to learn about? What are some of the curiosities you have? So we'll be sending out a survey from today's call as well. Thank you again to everyone for attending. And again, we'd love to bring you more like this. Thank you for joining Critical Conversations, a Cancer Learning Series. Have a great day.